this is a webinar on the yellow cellular repair protocol for ELIXIR MD. So what the yellow protocol is doing is targeting the mitochondria in order to improve and upregulate cellular repair mechanisms. It's basically kind of telling what needs to be done, how it needs to be done. It is the CPU of the entire process. So when you upregulate certain functions of that mitochondria, it's beefing up the cellular repair mechanisms. Now, same note, okay? As I said, there's a lot of signaling going on. There's two chemicals, cytokines IL-6 and TNF-alpha. These are signaling molecules which are pro-inflammatory. So the whole process of healing is this very fine regulated balance between you need some inflammation to draw these cells into the process to heal the wound, but you don't want to tip the seesaw so far over into the inflammatory phase that your wound healing goes down. So the body is responsible for judging this little seesaw balance. So now we said, hey, listen, this yellow light is upregulating the repair mechanisms. We've got these other signaling molecules, IL-6, TNF-alpha, which are responsible for the pro-inflammatory side. The other side of the seesaw, we're going to down-regulate those. So we're upregulating cellular repair, down-regulating inflammation to drive that reaction towards pro-healing. So the yellow protocol is also stimulating the smooth muscle cells of the lymphatic channels to really upregulate and pull that lymph fluid away as much as possible. So you're basically targeting three separate things. Number one, as we talked about, upregulating the CPU, the mitochondria, to go, yo, let's go heal this. Two, downregulate IL-6 TNF-alpha. And three, creating smooth muscle contraction in those lymphatic vessels to really pull the fluid out. So when you're doing these things together in concert, you're really trying to pull that reaction towards healing and speed that process up as much as possible. And you can see how you're going to increase healing, reduce swelling, because as you're pulling that excess fluid out, that's what's making your swelling come down. I hope this helps. And if you have any questions, don't hesitate to give us a call.